Hello and welcome. Today we're diving into a complex and heartbreaking neurological disease that affects millions worldwide, Alzheimer's disease. We'll explore what it is, what causes it, how it progresses, and what we can do about it. The exact cause of Alzheimer's remains a mystery, although researchers believe it's a combination of genetic, lifestyle, and environmental factors that contribute to the condition. Age is the biggest known risk factor. While some genes increase your risk, inheriting deterministic genes will guarantee you will develop Alzheimer's. Researchers are also looking into the role of cardiovascular health, head injuries, and education levels as potential contributors. Alzheimer's wreaks havoc on the brain through several key processes. The hallmark features include the accumulation of amyloid plaques and neurofibrillary tangles. Amyloid plaques are clumps of beta-amyloid protein that build up between nerve cells, disrupting cell function. Neurofibrillary tangles are twisted fibers of tau protein that accumulate inside nerve cells, eventually leading to cell death. These changes predominantly affect areas crucial for memory and cognition, like the hippocampus and cerebral cortex. Brain shrinkage, or atrophy, also occurs as neurons are lost, further impairing brain function. Alzheimer's is a significant global health concern. It's the most common cause of dementia, accounting for an estimated 60 to 80% of dementia cases. The prevalence of Alzheimer's increases dramatically with age. While it can affect people in their 30s, 40s, and 50s, especially in cases of early-onset familial Alzheimer's, it predominantly affects individuals over the age of 65. Millions are living with this condition, and the numbers are projected to rise substantially as the population ages. The signs and symptoms of Alzheimer's typically develop gradually and worsen over time. The most common early symptom is memory loss, particularly difficulty remembering newly learned information. As the disease progresses, other cognitive abilities are affected, including language, reasoning, judgment, and visual spatial skills. Individuals may experience confusion, disorientation, difficulty recognizing familiar faces or places, trouble with planning and organization, changes in personality or behavior, and ultimately difficulty with basic daily tasks such as eating and dressing. Diagnosing Alzheimer's can be challenging, as there is no single definitive test. Doctors typically rely on a combination of factors, including a thorough medical history, cognitive and neurological exams, and brain imaging techniques such as MRI and PT scans. Cognitive tests assess memory, language, and other mental functions. Brain scans can help rule out other conditions and identify brain changes associated with Alzheimer's, such as brain atrophy and amyloid deposits. In some cases, cerebrospinal fluid analysis may be performed to look for biomarkers of Alzheimer's. While there aren't distinct types of Alzheimer's in the traditional sense, it is classified based on the age of onset and genetic involvement. Early-onset Alzheimer's occurs before the age of 65 and is often linked to specific gene mutations. Late-onset Alzheimer's is more common, occurring after age 65, and is influenced by a complex interplay of genetic, environmental, and lifestyle factors. Some researchers also classify Alzheimer's based on the rate of progression, with some individuals experiencing a more rapid decline than others. Currently, there is no cure for Alzheimer's disease. However, there are treatments available to help manage symptoms and improve quality of life. Medications such as cholinesterase inhibitors and memantine can help improve cognitive function by affecting neurotransmitters in the brain. Other medications can address behavioral symptoms such as depression, anxiety, and sleep disturbances. Non-pharmacological approaches, such as cognitive rehabilitation, occupational therapy, and supportive care, can also play a vital role in helping individuals maintain independence and function for as long as possible. A strong support system is crucial for both the patient and their caregivers. While we can't completely prevent Alzheimer's at this time, research suggests that certain lifestyle modifications may help reduce the risk. These include maintaining a healthy diet, rich in fruits, vegetables, and omega-3 fatty acids, engaging in regular physical exercise, staying mentally active through activities such as reading, puzzles, and learning new skills, managing cardiovascular risk factors such as high blood pressure and cholesterol, and maintaining social connections. Following these guidelines can promote overall brain health and potentially delay the onset or slow the progression of the disease. Alzheimer's is a progressive disease, and the prognosis varies from person to person. On average, individuals live for approximately 8 to 10 years after diagnosis, but the course of the disease can range from a few years to more than 20. The rate of progression is influenced by factors such as age, overall health, and genetic factors. Research is ongoing to develop new treatments that can slow the progression of the disease or even prevent it altogether. Recent advances include the development of new diagnostic tools and the exploration of therapies that target amyloid plaques and neurofibrillary tangles. we are seeing new drugs being approved that are showing some promise in slowing the progression of the disease, offering hope for a better future for those affected by Alzheimer's. The scientific community is working tirelessly to unlock the mysteries of Alzheimer's and find effective ways to combat this devastating disease.